been an interpreter. I was about 7 years in the school system. She's also interpreted in healthcare settings and also in the court, and she's received specific training in those areas to be a more effective interpreter. So we're asking her just for a few minutes. We have until 2 for this portion of the training, just to maybe share some of the highlights. And if you have specific questions, this would be a good time to ask her too, if you've worked with interpreters and you have a question.
Thank you, Janet. Again, my name is Aline Mukiza, and thank you, Janice, for welcoming me here. So I will just be speaking briefly about the interpretations, and I would love to know, just to hear from you what you know about what is interpreting? What is it? Who can tell me what it is? Versus translations, because I hear many people say, can you come and translate for us? Can you come and interpret for us? So gets confused sometimes. And
what's the difference between interpretation and translation?
Can anyone tell me? Yeah.
Between the nuances in the actual words and what the implications are of those words.
Oh,
close.
It's almost, yeah, it's almost close. Yeah,
interpretation, there could be your own bias put in there. With translation, it's literal.
Oh, great. Good. Do you want to try?
I was just saying, when you were talking about it, what other people had said, translation, when I think of we need an interpreter, it's someone saying something, we don't understand it. You as the interpreter are saying, this is what they're saying,
yeah, good.
And I'm telling them back.
So what do we know, like when we say, I want an interpreter, I want someone who can convert this language into the other language, just in a spoken way.
Spoken to spoken.
But when we say translator, it means someone who is coming to change the document into that spoken language. But it's not something that you can speak just face by face, but it's something that you translate is word by word. So when you say translator, it means you are coming to change a word. I mean, writing a word.
So it's a whole different skill set for a translator than an interpreter.
Yes, yeah.
Written versus spoken.
So the reason why I'm here, I'm not going to train you about this kind of stuff, but I wanted just you to know what is the differences and what the guidelines on how to use the interpreters and translators. First of all, the interpreter is someone who is Jen spoken something like Jen. Oh, I know your name there. So the interpreter is someone who is sometimes works as a cultural broker, as I said, and Jen has explained this before. So the cultural broker is someone who knows the culture of that person, like a client. So I'm actually, when I'm there to interpret, I'm on, like, I have 2 different jobs. I'm a cultural broker at the same time as an interpreter, that I know why this person is thinking the way they feel. For example, I usually like to give the stories and examples. It might happen, for example, maybe we're in the room, and as a patient and a provider, you are expecting me to interpret everything as it says. But the client is a kind of talking behind the scene, telling me something that you don't even know, right? And we are speaking in our own language. You can't even know what we are talking. But knowing this is a value and beliefs, the client tells me, don't tell the doctor. You know, don't speak to the doctor because this is a confidential. I said, well, this is not how it should. I'm a professional interpreter, and I say, well, this is not how it should work. I have to speak everything you say so that we have the transparency between the scenarios in there. But it happened one day, the client was telling me, you know what? Whenever I come here, they always give me the pills, just like medications. But I really prefer. Do you think I'm going to be? I'm not gonna be treated well. I'm not gonna be cured by these pills. I said, why? I knew why he's thinking like that. I was like, you know, in our country we don't use pills. Usually when I go there, we prefer a shot. You know what I mean? So it's like, okay, I remember now. So when you prescribe a client, like, go take pills for many days and you don't see any improvement, then he or she prefers a shot. Whatever happened, whatever the reasons, if you give him or her a shot, then they will say, oh, I'm now cured. I'm treated well. Has it happened to you when you prescribe medication to the client and then tomorrow the client comes back with the same problem which you already treated, right? And you feel like, did you take the medications? I say, yes, every day. But what about if you change with the shot? She will say, or he will say, oh yeah, this is really, and you will see some changes, of course. Yeah. So those are some the cultural thing. Or they say, I didn't eat, my child doesn't eat anything. But don't mean that they didn't eat anything. Because sometimes they don't eat, maybe we like to eat, who have fufu, ugali? Mm-hmm. Have you heard that word before? So for example, maybe my child doesn't eat ugali in Swahili. It's a Swahili, which means a cornbread with fish. So if my child doesn't eat a corn and a cornbread with fish, then, oh, my child doesn't eat. My child doesn't eat. And you ask the client, really? The child doesn't eat? How does he or she survive? Say, he doesn't eat. I tried my best, but they eat the other food different from what they expected their children to eat. That's what we call the interpreters as a cultural broker. Sometimes I say, okay, as an interpreter, I want to interrupt you. So that means I'm a professional when I say like that. But how can you know that I'm a professional interpreter or not? Sometimes you keep talking with the high register English, with jargons and, but and you know that the interpreter didn't understand what you said, but the interpreter just interpret without even asking for the clarification. So that means the interpreter didn't translate or interpret the word accurately when when he or she doesn't ask the question for the clarification. So that's the other role, the interpreter as a clarifier. I have to ask you if I don't understand. Can you explain this word? Because there's some terminologies, especially medical terminologies, are very high, hard to understand and know. But I have to ask you so that I can explain it to this client in a good way. The other thing is the interpreter as an advocate. So I advocate for my clients sometime but this is rare. I have to call this shows the professional interpreter though. But I speak on behalf of the patient when something went wrong. For example, maybe I was there and the client told you to treat him or her this way, but he wasn't given this way. He wasn't treated this way. So what I do, I don't call you or call anyone from the hospital. I call my director, maybe, or my coordinator, who sent me to come to there. So I know Fred Allen or UHC have the person, Mary Gordon, who is coordinating these translations. So they will call Mary Gordon and they connect you with my coordinator. And interpret again as a conduit. What is a conduit? A conduit is the interpreter has to explain everything as it's said. For example, I don't add anything or omit anything. I will say exactly as you said. So when you explain, when you say something, maybe, for example, a word that I didn't understand, I will ask you for clarification. And I will not add anything, even if I know what it is. For example, maybe green card. Green card is a universal word that we have. I don't know even how to change it, but I say it as you said it, as a green card. But I know how to, I can explain it in details, but I will not explain it. I will ask you just to explain it so that I can explain to the client. Yeah.
Are we about done?
Almost done. So I'm almost done. Those are where I gave you 4 key roles of interpretations, like the roles of interpreter: a conduit, clarifier, cultural broker, and as an advocate. Those are the 4 things that guide the interpreters. And if you have any question, please, you can ask me.
Great.
Thank you.
Thank you, Aline. We're really fortunate to live in an area where your best resource is other people in the community. Kathy Kelly, who's a social worker at the UVM New American Clinic, she did, and many of us attended it. I don't know if anybody else did. She did a course, a basic interpreting course, and then she did an advanced. And talk about the things I learned I didn't even know I needed to know. So Aline was touching upon some of this when some people were saying the translator is bringing meaning to the words. That's kind of, she was moving up this kind of ladder of the different roles an interpreter plays.
I have a question.
Yes.
If you're interpreting for someone and they're telling you something that they said, I don't want you to tell the doctor, or I don't want you to tell my case manager or my social worker this information, and it may be information that's deceptive, that's even possibly committing fraud or eligibility for a program. What responsibility does the interpreter have?
I'll let Aline answer that
I
question.
can answer that.
Yeah, you want to just take, is there a microphone back there? Oh, all right. They're going to play volleys around the bowl. We have to be entertaining after lunch to keep everybody awake. Just real quickly, if you could answer that question. Yeah.
So when it happens like that,
Hold it close enough to your...
The professional interpreter is someone who interprets everything. As I said, is a conduit. That means you don't have to add anything or omit anything. So the professional interpreter will explain everything said there. But, well, I think I don't have enough time, but it's like when as an interpreter say, please, I will not tell you when the client told me why you are not there. When we are in there, like 3 of us, and the client tells me that don't tell that, I will say I will tell him or her. But if the client tells me while the doctor or provider is outside, I will not tell you.
I got it. Yeah.
Did you understand?
Yeah. They explain the expectations often in a pre-session. It's really important. I mean, a professional interpreter will tell all the parties involved that this is how the process is going to work and what to expect.
Yeah, the thing, it's like you do, like the professional interpreters, they do something called the pre-session. Pre-session means I will tell
pre-session.
Yes,
yep.
The way I'm going to interpret. I will say I will interpret in this kind of language, maybe Swahili or French, and then everything will be confidential. I will explain everything as it's said in there.
Even saying interpretation is word for word is a little bit misleading because you have to bring meaning to those words. I went to a thing they had at Winooski Elementary School for New Americans, and there was somebody talking about some things, and they used the word libel. So I was watching the interpreter, and he spoke in Nepali, and he said the word libel. I went out and talked to him afterwards. How do you describe that to people? You know, the world of insurance when you're from another country. So